My name is Jeanette Cates. I was 69 when I was diagnosed with breast cancer in both breasts, had to face a double mastectomy. My husband, Bob, has been my right-hand man, and we actually call him Saint Bob because he's been such a fantastic help throughout this entire process. Anytime you're facing a diagnosis like breast cancer that's going to be life-altering, it's really important that you're comfortable where you're going to be treated. So my first visit to Dr. Fisher's office was definitely a very pleasant one. It was a sense of relief. It's a very calm atmosphere here. And we were greeted by a very friendly staff, well-spoken and very solicitous in terms of recognizing what we were going through. One of the things that immediately impressed me was the fact that Claire, the patient coordinator, had been through this whole process herself. So it was immediate recognition of what I was going through, and she was extremely helpful.
Well, there's a lot of things that go through a person's mind when something like that happens. And it's not the first time, although this was probably the most serious of things that have happened to Jeanette in her life. But I see my role when these things happen as major support. And so I look for her. She does a lot of research when she comes upon these things, and she did that research and said, well, want to go talk to Dr. Fisher? And I said, fine. She said, can you come with me? And I said, sure, let's go. And when we walked in and talked to Dr. Fisher, she made us feel at ease. She cared, and that makes my role as a support person much easier. When I know that the person who's going to be caring for her cares as much for her as I do.
The first thing I remember about Dr. Fisher is her great smile and her caring attitude. She listened. I came with a long list of questions. So she listened as I asked the questions. She got out her famous board and began illustrations and talking about the various options. We could do this, we could do that. Here's what this would entail, here's what that would entail. We continued asking questions as she was drawing on the board. And then she said, okay, so let's decide what might be the best approach for you. And we narrowed down the options, and she said, okay, this is going to be what I would recommend for you. We could do something else if you really want to, but I would not recommend it. So we said, okay, let's go with that. And she was able to then walk us through the process of exactly what I was going to be going through, the time schedule, and how long it was going to take. I had done a lot of research online and in several books that I had obtained that looked at the differences between, for example, the flap surgery and having implants. And of course, I was thinking the flap surgery would probably be the best. But as we examined the options, I was not a good candidate for flap. So we looked then at what were the different types of implants and decided on the silicone implants. Recovery was not really as bad as I thought it was going to be. I was in the hospital for about 2.5 days. First day, I don't remember a whole lot. I was on a nice painkiller. By the second day, I was getting up, and that's when I first recognized that I had T-Rex arms. So that was interesting. T-Rex arms are when your arms are at your side, and when you try to reach up, they don't go anyplace. It's kind of like working like this. So scratching my nose, I was bringing my head down to reach my nose. That eventually clears up. It takes several weeks and a little bit of work in order to get that, but that was a real realization when I first woke up. And then going home, the pain was not near what I thought the pain was going to be. It was sometimes hard to sit up all the time because you don't want to lay flat. You want to have them heal as best as possible. So you want to sit up rather than laying flat or laying on your side. So that took a little bit of adaptation. But you're really living kind of a 24-hour lifestyle. I think that's important to recognize that you aren't necessarily going to eat breakfast, lunch, and dinner on the same schedule that you had before. When you're hungry, eat. If you're not hungry, sleep. So just go with what your body is asking for. When I first came to see Dr. Fisher, my main concern was what was it going to be like after I had a double mastectomy. I grew up in a time when you just assumed that they essentially chopped off the breast and were left flat-chested. And I wasn't comfortable with that option. I know a lot of women do choose that option, but that wasn't something that I was interested in. So I was interested in having breasts again. I was very pleased when I woke up in the recovery room right after my mastectomy and found out I did have breast already because the extenders were already in. And then that was kind of a fun process going through each time we came for a fill on the extenders, finding out, how much bigger are they going to be, how much heavier are they, and finding the size that you really wanted to be ultimately so that you could heal at that size. I think that overall the whole process was much more pleasant than I thought it was going to be. I was extremely pleased with my surgeries. The surgeries went very smoothly. The recovery went very smoothly. And I was feeling very good about it. But I didn't feel complete until the final step, and that is getting the nipple tattoos. That makes a huge difference. And with Dr. Fisher offering that service, I just cannot recommend it highly enough. It is something you definitely want to do because it makes all the difference in the way you look at yourself in the mirror.
I think some of my favorite memories of Dr. Fisher and the staff was just that everybody really seemed to care. People understood the situation, the trauma that people were going through, and really took that upon themselves as something that they cared about, and they wanted to make it as painless as possible. And one of my first memories of Dr. Fisher, Jeanette's already alluded to it, was the fact that when we first met her, she was very humorous, always had a smile on her face, and I think we were talking to her, and she said, well, wait a minute, stop. She said, I got to move over here, and I got to draw this out. She said, I can't really do this unless I'm drawing it on the board so we can see what's going on. And I just thought, well, that's just so cool because, not only does it help her, but it gives us something to look at that we can do. So I always thought that was kind of cool.
One of the things I remember Dr. Fisher talking about was her uncanny ability to judge breast size. And I thought, what a perfect talent for a plastic surgeon, that indeed she could do that. And she teased about the fact that she would decide when we were actually in surgery what the proper breast size would be for the final implants. And indeed she did. So I thought that was a very interesting aspect of her personality. When I was first looking for a plastic surgeon, I had done some research online, gotten some recommendations from my other doctors, and I began making telephone calls. And as I called various doctors' offices, I was amazed at the coldness of the people on the call. It was as if I were just another number. Now, this is at the time, I've only been diagnosed a week or two at that time, and there's a lot of trauma going on in my life. And the fact that they kind of thought that that was a number, what kind of insurance do you have? Well, I'm not sure we handle that type of insurance, et cetera, that wasn't what I was looking for. So I continued to look until I found Dr. Fisher. And looking through her website, reading some of the information that she provided, looking at a lot of the pictures that she provided on before and afters, and then calling her office and having such a warm reception, quiet calmness, and professional approach to it really made a huge difference.
I try to ask her questions when she's going through things like this to make sure that she has a good understanding of things and she knows what she's looking for. And I can always tell the difference when she starts explaining the different people she talked to and, some of the things that were going on. How when she started talking about Dr. Fisher, her voice took on a different inflection. Her face lit up a little bit more so that, I could tell that she really enjoyed the interaction that she had had with Dr. Fisher and the office personnel prior to then, and we really hadn't even gotten in to see Dr. Fisher at that time. So, from my standpoint, it's, well, again, if she's found someone that she's comfortable with, then that's going to make my job that much easier. So it was great.